On this episode of the Athletic Potential Podcast, we will be discussing how to manage in-season shoulder, elbow pain. Welcome to the Athletic Potential Podcast, your place to come and get answers to your athletic development questions. We cover a range of topics, all related to helping you to achieve your athletic goals so that you can experience and enjoy the athletic career that you deserve. I am your host, Dr. Mike Matthews. Hey everybody, and welcome back to the Athletic Potential Podcast. Thanks for tuning in for this week's episode. We're kind of excited. This is, we don't really typically announce how many episodes we're at, but this is episode 50, and it's always fun to meet these big numbers. I listened to a lot of podcasts, and I heard a stat one time that most podcasts don't last longer than 7 episodes. So to make it to 50 is always kind of fun, and to think about the things that we've talked about here, and hopefully we're getting good information out to everybody, and appreciate everybody for supporting the podcast. And so it is a question-driven podcast, so if you have questions, make sure you ask them, and we'll get them answered. And so today we're going to go back to our normal format. We're going to take one question today because it is a good question. It is a timely question as well. We try not to date the podcast, so when they're being recorded and those type of things, but I think it's important to talk about this topic as we seem to be getting a lot of questions about it at this time. We are in the time of spring where playoffs are starting for baseball and softball, and this is typically where we start to see some nagging injuries become problems, and we also see games start to becoming more frequent and more important in the sense that we keep players on the field so that they can compete for championships. So there's a lot of things that a lot of times I'm giving out similar advice, and we happen to get a question talking exactly about that. And so we'll dive right into that question and get going, and hopefully it helps. So our question at this point comes from Clint, and Clint asks the following question: what is your preferred method for dealing with pain in the elbow or shoulder when you're still trying to compete? I understand that if it hurts when you're throwing, that the recommendation is typically to stop throwing, but what if you are in a part of the season where you want to continue to compete, potentially to win championships or to make it further into the playoffs? Do you have any advice in keeping pitchers and or position players on the field of play despite having elbow soreness that it maybe even progressed into pain? Thanks for your help and appreciate your information. Clint, this is a great question. So this is something that around this time of year here at Athletic Potential, we typically deal a lot with. And it's one of those that when our clients come in, and these clients come in and they're saying, look, I've got a game on Friday and my elbow's hurting pretty good, and right now it's going to be hard for me to pitch at all or to even play, maybe it's a position player, maybe even throw at all on Friday. How can I get better by Friday? Say it's Monday, right? What's the best thing I can do to get me the closest to normal or back to normal by Friday? And I can tell you this, that there's a certain sequence that I seem to always be recommending. And let me just first and foremost tell you this. This is typically not an ideal situation. Right, we're basically saying, look, we want to compete. You want to go out and play in the playoffs. You want to give your team a chance at winning. And I can tell you right now that typically we're not going, you're going to be 100% for these games, even though that does happen. But a lot of the time what we're saying is, look, we're going to get you as close to as 100% as we possibly can. Sometimes it may not even be close to 100%. Maybe we'll get you to 80%, but your 80% may be better than the next guy up who would be behind you, right? And so the idea is to get you back to a level of playing that will contribute to your team's success or hopeful success at this point in the season. So I can tell you this is the first thing. There's 4 main points I want to make, okay, about dealing with short-term or new, in the medical world we call it acute or short-term or new pain in the elbow or shoulder. Now, first and foremost, I can tell you this. If the pain is sharp and it is high, meaning 5, 6, 7, 8, and obviously above that, if it's that bad, there's no way you're going to be able to do this on your own without help. If it is substantial pain, being able to just do some of these things I'm about to mention will more than likely not get you to where you need to go. At that point, you need to go see someone, a clinical specialist, that can help manage the pain, but also get you prepared for your next competition. And even that, the answer may actually still be, sorry, you're not going to make it. It's not in your best interest to try and push through this. You're talking about long-term damage, those type of things. If you are in this situation where you are uncertain whether or not, throwing through this type of discomfort or your pain levels are that 5+ or beyond, then you need to go see somebody. You need to get it checked out. If you try to play through it, you could potentially, one, you won't be any good maybe on the field, and two, you may actually jeopardize the health of your arm for many months to come. That would not be worth it. So it's worth going to somebody who can give you good information and give you good clarity in regards to decision making there. I get this question all the time, and I apologize as it sounds like a shameless plug, but I always mention, hey, you need to find somebody who knows what's going on. That they know baseball, they know softball, they know it doesn't matter your sport, that they just know that. So they know throwing, because I can tell you right now, one of the things that I heard just the other day was, hey, I went and saw my blank. I won't even say if it's a doctor, physical therapist, chiropractor, whatever, athletic trainer. I won't even mention which profession it was because it doesn't matter. And that person said, well, hey, if it's doing that, you're done. You need to be out for 4 weeks. And to me, I'm talking to the same player, and I ask them questions. How much does it hurt? Where does it hurt? How did it happen? Have you tried anything yet? What's worked? What hasn't worked? Have you improved? Has it been getting worse? These are all questions that more than likely were asked. Okay. But this player was told, no, you're 4 weeks, you're done. Don't even think about it, beyond that. And I evaluated the player, and I told him, I said, look, you want to play in 9 days. And in 9 days, I am anticipating that I'm going to have a very hard time getting you back to where you think you need to be in 9 days. Right? And I told him, but here's the deal. If your team wins this first round, you're going to play in 12 days. And now in 12 days, I may get you pretty close. Okay? But you have to do these specific things, and it's going to take this much effort, energy, and effort. And the player asked me, he goes, well, hold on. You're telling me it's possible in 12 to 14 days. My whatever is telling me it's not possible for 4 weeks. You're talking days, he's talking weeks. Or she's talking weeks, right? And I told him, I said, well, look, unfortunately, I think what's going on is that they gave you a diagnosis, and based on just the diagnosis, they gave you information that, oh yeah, in order for this to heal, it takes 4 weeks. And the answer to that is probably true, that it might take that long for it to heal. But at the same time, I said, I don't think in regards to throwing this injury, we can work around it, or we can do things that'll mitigate it, and you'll be able to perform. And maybe you're not going to be doing this position, but you'll play this position. So, and I apologize for the tangent, but here's the deal. If you go somewhere and they don't know throwing, then I would highly suggest you find someone who does. If you do not, shameless plug, if you do not have anybody, look us up, Athletic Potential, athletic-potential.com. Call our number. You will talk to me, or we'll talk to someone, and we will get you good information. We do virtual visits all the time. Those are typically consultations where we talk about your case and make sure that there's, see what we can do to help. And it may just be that I confirm the information from whoever else you saw, or it may be that I lay out a plan for you and we go from there. So, and that is something that we're happy to do. We want everyone to play when they want to play as much as possible. Obviously, we're going to put your health in the context of what's best for your health, long term and short term. But just know, if you're having a hard time finding someone that you would trust in regards to a throwing sport, give us a call, text us, email us. We're happy to help. Okay. Now, I say that because I know what happens, and I know a lot of people just go with it. But I can tell you this, that we have had athletes here at Athletic Potential that came in with substantial pain in their elbow and their shoulder, and we were able to get them to compete in their playoffs and in their tournaments and do well. And that's because we took a very, individualized, comprehensive approach based on the athlete, not just based on what some research says that we should do. Okay. So sorry, major tangent. Typically I get more emotional than I am now, but I'm trying to keep it under wraps. Okay. I want to make sure everybody gets and maximizes their potential as much as possible. And you do that through good information. So reach out if you have that. Now let's get back on track. Clint, if you're dealing with minor aches and pains, we'll say a 4 or less on the pain scale. Here's the 4 things that I tell everybody you need to do as soon as possible. First and foremost is actually something you should not do through this entire process. Okay? This is for shoulder and elbow. You are not to do this. I have yet to see a situation where this has actually been beneficial, and I know they exist, and I'm sure I'm going to get hit by a bunch of people being like, look, it actually helped me doing this. And I go, yeah, okay, great. But here's the deal. Number one, first and foremost, you do not ice it. Okay? Ice will set you back days in this process. And days will turn into games, and eventually you may not even get back because you put yourself beyond what your tournament dates are. Okay? Do not ice it. Number one, do not ice it. Okay? Number two, you want to maximize the amount of blood flow that is to the area. Now, we're talking elbow and shoulder because Clint asked elbow and shoulder. No, this can be applied anywhere in the body. If it's a hamstring pull, maximize blood flow. If it's an ankle sprain, maximize blood flow. If it's an elbow, sprain or strain, maximize blood flow. How do you maximize blood flow? You get your heart rate up, okay? You can heat it. I know, I just told you not to ice, and then I told you heat it. Way contrary to what it seems like everybody, what's been told and everything. The RICE, rest, ice, compress, elevation is not nice. It is not nice. It does not help. Okay, it 100% doesn't help. It makes it harder for you to recover and return. Moving on. So maximize blood flow. You maximize blood flow by getting your heart rate up. You maximize blood flow by heating it. You maximize blood flow by flexing the muscles that are in and or around the area that you want them to. Now, let's give you a more specific example, Clint. We're talking about elbow. Let's just say inside of the elbow on a thrower, right? Baseball player, softball player, they all get it. But you want to maximize the blood flow through there. How do you do that? Well, first and foremost, I can tell you right now, you need to avoid pain as much as possible. Now, once you've done that, you're going to think, where are the muscles in and around the area where we're trying to get is maximizes blood flow? If it's in the forearm, that's all your finger muscles and your wrist muscles, right? And so what you're going to do is light finger squeezes. You're going to do light range of motion through your wrist. And notice I'm saying light, right? And start moving those muscles. And what happens when you do that is the blood flow is essentially sent down to that area because you're using the muscles. You can flex and extend, flex your bicep and flex your tricep. That's the muscle in the front part of your arm and the back side of your arm, okay? And then you can do arm motions and shoulder motions and those type of things. That's going to help with blood flow through the arm, okay? So number one, don't ice. Number two, maximize the blood flow to whatever region that you're looking for. We're talking about shoulder and elbow. Move your arm, move the muscles, flex them. When I say flex them, you're not like pulling against weight. You're literally just making a fist, moving your wrist around, bending and extending your elbow. If that doesn't hurt, if it does hurt, then you just flex your bicep and you flex your tricep and your shoulder. You're moving your shoulder around, right? Or you can push and pull against bands or against a wall. If you want to know a great routine that we typically use for this, you can use your J bands or any type of bands, and you do what's called dynamic isometrics. On my YouTube, look it up, dynamic isometrics. It should be a playlist. If you look it up, if you do those 6 movements and you do them without pain, it's a great way to get blood to the shoulder, okay? And so actually to the forearm too. All right, so number one, no ice. Number two, maximize blood flow. The next thing you need to do is to normalize and or restore the range of motion that you may have lost. Let's talk elbow. In throwers, what we see over the course of a season that most throwers lose elbow extension. So they cannot get their arms straight. Okay, so their arm stays bent. Okay. Those watching the video can see me doing this, but those can't see the video, just listen online. My elbow, I'm simulating as you go to straighten your elbow, there's still a slight bend in it. That's actually a normal response over the course of a season based on the research. But you got to restore that. If you're in pain, if you're having issues in your elbow, you need to restore that. How do you restore that? Okay, you heat it, you treat it nice, you turn the blood flow, you maximize blood flow, and then you slowly try to extend it out, avoiding the pain as much as you can, okay? Okay, and then same thing with the bend. If you've lost your ability to flex your arm, then you're going to want to slowly start flexing it and try to restore it, okay? Same thing in the shoulder. Start moving your shoulder around. You can do exercises like ring or suspension trainer walkouts. You can have somebody move your arm for you and have them stretch it out nice and easy. Anything to restore normal range of motion, whatever it is we're looking at. Okay. So number 1, don't ice. Number 2, maximize blood flow. Number 3, you want to restore any lost range of motion that is present because of the issue that you're dealing with. Once you have done that, the 4th thing you're going to do is do exercise to promote recovery. Now, this gets a little complicated. Okay. Now I'm going to try and simplify it, but let me just try and make it as simple as I can. When you are doing exercise for the sake of improving muscle quality and or recovery, you are not burning muscles out here. What you're essentially doing is going anywhere from 30 to 40% of that muscle's ability to contract. Okay. So think if you're like full bore, like, that's 100%, you want 40% of that. And you want to go through all of the range of motion you have. Okay. And you only want 40%, and you're only going to do 1 to 2 sets and never to failure. Okay. That is going to promote recovery. By the way, promoting recovery is very synonymous with maximizing blood flow, but you've got to put enough load on these tissues, on these muscles, on these ligaments, whatever it is we're dealing with, that it will get the body to heal it or to respond to it by trying to promote healing through that area, but not so much that it causes it to essentially be too much and overload it and essentially restrain or resprain it. Okay. I use the number 30 to 40% because that's where I feel like in regards to my practice, that if I can load somebody 30 to 40%, we see the best results in regards to recovery and or the tissue ready to do whatever it is that we want it to do next, right? So that'd be throwing in our case, right? So those 4 things, no ice, maximize blood flow, restore the range of motion that you lost, if you lost any, and start a light exercise routine that will promote recovery. If you do those 4 things and you do them consistently, these are a daily occurrence, okay? You're going to give yourself the best chance at getting back. That's if you have like these minor aches and pains, okay? Now, I know I'm going to get this question. And that's okay. It's good, or at least comment. And that is this. If you have options in regards to technology such as electrical stimulation units, I would use them. Okay. I can tell you right now that one of the things that I heavily recommend, we talked about improving blood flow, right? One of the things I heavily recommend is electrical stimulation device that flexes your muscles and relaxes them and that you can leave on for long periods of time. Okay. There's a lot of brands. I have no affiliation to any of them. I don't receive anything for any of them. So I'll just tell you the top 2 I normally refer to. Mark Pro is the first one, and then Compex is the second one. Now, I have both of them. I recommend both of them because they're a much different price structure. Okay, Mark Pro is a little more expensive. The Compex is a little less expensive depending on which one you buy. People always ask me, which one do you want? I have a Mark Pro. Okay, that's the one that I recommend. I feel like it works the best. Okay. But I don't receive anything from Mark Pro. But anyway, so I like those. Those are the way you want to use those is essentially what you're going to do is put the pads on. Now, remember we talked about in order to maximize blood flow, one of the things that you do is you're going to contract the muscles in and around the site of injury or pain, right? Mark Pro does that for you, or these electrical stim devices do this for you. You don't have to think about doing it. So what that allows you to do is put it on and leave it on for long periods of time. We're talking hours, okay? I know I can tell you right now, I have a protocol that just worked for someone who had an ankle injury. They slept with this thing on. Hours and hours and hours to try to maximize this blood flow. It's non-fatiguing muscle contraction. Okay, we're getting into the weeds a little bit here. But the idea is if you have options to these electrical stimulation devices, they can help. Now, I have people always tell me like, hey, I got this little TENS unit that I got at the mall or on Amazon or whatever. Does it work? I don't know. Okay. I don't know. Like there's so many things out there. I can tell you right now, if it has an electrical muscle stimulation setting, it might work. It might work. But I can tell you right now, I've yet to find a cheaper or very inexpensive option that is good beyond the 2 options I already told you. Okay. So if you're a serious athlete or a parent of a serious athlete or an athlete who's, heavily involved, these 2 products are worth your investment. Again, I don't receive anything for it. Okay. But I just want to make sure that everyone knows that. clients that come in and work with me specifically to try and improve these things, I've definitely would tell them to get those things, or I've loaned out the ones that we have here at Athletic Potential. We do send them home with our clients, and we see the best results when we do that. So something to think about. If you have questions on those, you can always give me a call or text me, or text our number here at Athletic Potential. Okay. So if you have options in regards to technology, they can help you. Now, I know, Clint, you're asking this question, what should you do? I gave you the 4 things. Those are the 4 things you want to prioritize. Okay. One of the things I didn't say was rest, because a lot of people are like, well, do I just keep playing through this whole thing? And the answer is you have to let pain be your guide. If your pain is, 3 or above during activity, you probably shouldn't push through that and should stick to these principles until the pain levels drop to 3 or below, 4 or above. And if they're at 3 or below, then yes, you may participate in your sport. If they're more than that, then you need to go to these principles: no ice, maximize blood flow, restore your range of motion, and exercise for recovery. If your pain levels are higher, you need to get on those 4 things. If your pain levels are 5, 6, or obviously above and sharp and stabby, you need to go see a clinical professional. Now, I can tell you this: someone's going to ask me, or someone's going to comment, okay, well, what's the best option that I can do? I always answer that question with, if I am in your situation, but I know what I know now as a physical therapist, strength coach, what would I do? I can tell you right now, if the tournament is of substantial benefit or worth or significance, I am paying a professional to take care of this. I know I'm a professional who gets paid to take care of this, so it's a shameless promotion, but I can tell you right now, there's a reason that I have a profession that exists to do these kind of things, because it is that important. And if you do have an option of someone who can help you, you should take it. It will absolutely give you the best chance of performing, not only getting back into performance, but also performing at the highest potential level you could, based on what you're dealing with. Okay. We have had clients come in, baseball players, softball players too, but we'll stick with baseball because they seem to be more with these, cranky elbows, inside of the elbows, or even sometimes full-blown UCL sprains, that will come in. We will work with them extensively. We're talking daily, and they will go and participate and pitch in a full game and be able to and do so and do well and contribute to their team. And as soon as they're done pitching, we start the process over again. Okay. We call it the Humpty Dumpty program. It's what it is. I call it that. It's probably not politically correct, but I don't care, in the sense that that's what we call it, because we know that player is going to go back out there. They're going to essentially re-aggravate all the tissues. And so long as we don't feel like it's going to dramatically affect them in a long-term way in regards to their health, we help them get through it. And I don't think that happens unless you come to someone who can help you with that. So ideal scenario, you are seeing a rehab specialist that can help you with that. Okay. Now, a lot of people say then, okay, well, if I go to a rehab specialist, what should I be looking for? Or what would you do? Okay. I'll give you the quickest answer I can. And I'm going to let's use elbow as an example. Okay. So say I have a throwing client who comes in. This could be javelin. This could be baseball, softball, volleyball, any of these type. Okay. They come in and I diagnose an issue to the inside of the elbow. We'll call it a flexor muscle strain. Okay. What do? First and foremost, I do exactly what I've already told you. I need to maximize blood flow to the area. How am I going to do that? I have additional ways of doing that. Okay. We can use cupping. We can use other massage techniques to improve blood flow through that area. We use a very unique form of electrical stimulation to help improve blood flow to that area. Okay. It requires specific devices and the know-how to how to apply it. Okay. So we use that. I typically in these clients will dry needle them. I'll use dry needling to improve blood flow, but also decrease pain and sensitivity. Okay. So a normal day would look like they'd come in, I'd take a look, we'd stage the injury, see where it's at in regards to the healing process. Is it really bad? Is it turning the corner? It's coming around. It's still there, but it seems to be improving. Is it fairly well improved? Okay. Let's just say it's still pretty new. It's not turned the corner yet. They come in. First thing I'm going to do is test it. Second thing I'm going to do is do a hands-on technique to restore any range of motion that has been lost. Once we're done with that, they're going to go through a full electrical stim therapy session with me, doing movements and other things to try and promote good movement, good blood flow, and good mechanics of movement using the electrical stim device. When they're done with that, we have them lay down on the table and we put their arm in a certain position that allows us to do dry needling on the select tissues that we're dealing with. Once they are done with that, they go to a recovery protocol and electrical stimulation device that I've already mentioned. They do that for the next 20 minutes, and then if they can, they take one home, or if they have one, they are to then do it for the next 2 to 4 hours. That's what they do on day 1. They'll return for day 2. They'll return for day 3, return for day 4, and maybe in return for day 5, because most people have to return on day 5 back to their sport. And that's what we do until they're able to participate. So, Clint, this is a long-winded answer for one thing, but I think it's something to know that it kind of gives you a broad base of what happens. Okay. So if you really want to know what you should do, go through those things. Let's try to bring it all back into a summary. Okay. If your pain is 3 or less, you're going to follow the 4 things, but you can continue to participate in your sport. If your pain is 4, 5, you're going to do those 4 things and hold off on your sport until your pain levels drop. Okay. It may even just be 1 day, by the way. It might be hours. It may be 3 days. Okay. Once your pain level hits 6 and higher, I know I said 5 earlier. Let's just make it 6. 6 and higher, highly recommend you go to a rehab specialist to help you out. If you decide not to, you need to do the 4 things. Okay? 4 things. No ice, maximize blood flow, restore range of motion, and do exercises to promote healing. Okay? That is what I'm going to tell you to do. And I think if you do that, you give yourself yourself or your player the best chance of getting back to the sport in a time period that allows them to contribute to, either if they're, track and field, then gives them a chance to participate in the meets and do well. If they're on a team sport, then helps them to contribute to their team winning and maybe making it to another, tournament or a championship or any of those things. So Clint, it's a great question. It's something that we absolutely deal with all the time here at Athletic Potential, and we have helped a lot of people. And I definitely want to get the word out in the sense that a lot of people feel like all they can do is, heat it, or I know in worst case, like people always talk about it, the people ice it and be like, oh, I'm going to be good for tomorrow. And then I'm going to show up and go and I should be good, or I'm going to take ibuprofen. I'm going to do all these kind of things. We didn't even get into like icy hots and other things you can rub on it. I'll be honest, unless you do those 4 things, it doesn't matter. Like you're not going to see the results you want to see. Okay. There's taping strategies and stuff like that you could use, but if you don't do those 4 things, you're kind of really putting yourself in a disadvantage. Again, if you are wondering what you should be doing and you don't feel like you have good anywhere to go to, please just give us a call, text us, email us. I want to help. Okay. And I know, shameless promotion, but realistically, the entire reason that my business exists at Athletic Potential is to help athletes stay in their sport, stay in their activity, continue to compete, continue to participate, and to do so as the maximum potential that they can. And some people stop participating or are told they can't because of bad information, because of, either they read the wrong thing or a medical specialist says that they shouldn't, and they don't really know. And unfortunately, that does happen. Not all the time. A lot of time it's great advice, but sometimes it's bad advice, right? So anyways, I appreciate everybody tuning in. I appreciate everybody taking the time to listen to the podcast. If you do have questions, please ask. We'll get your question answered. We answer any and all questions that we do get. Some of them don't hit the air because I answer more specifically, so know that. If you're one of those I responded to individually, I did answer your question. I just didn't answer it on the air. Okay. Please ask your questions. We want to make sure we get good information out there. If you do need help or anything else in regards to your athletic career, we're happy to help here at Athletic Potential. Just reach out to us. Go to our website, www.athletic-potential.com. We're happy to help in any way. I appreciate everybody taking the time, and we'll see you next time. Thanks. Hey everybody, just want to say thank you for listening to the Athletic Potential Podcast. If you do have questions for the podcast, please visit the website, www.athletic-potential.com/podcast. You'll find a button there to ask your question. Please input your information and your question, and we will answer any and all questions we get. We thank you again for listening. If you do get a chance, please rate and review the podcast. And until next time, thanks.